Hi, my name is Arif Alkali. I am one of the hematologists at Mayo Clinic, and I focus on treating patients with myelodysplastic syndromes and acute leukemias. I'll be talking about our paper showing up at the Mayo Clinic Proceedings, August 2019, with the title, Outcome of Myelodysplastic Syndromes Over Time in the United States, a National Cancer Database Study from 2004 to 2013. In this study, we published our experience using the database of the National Cancer Program about more than 50,000 MDS patients. By far, this is the largest study published in patients with myelodysplastic syndrome. And what we looked for in this is about several issues, including the age at this diagnosis that was given, which was 76 in patients with myelodysplastic syndrome. We also looked at the most common subtype that was noted by many of the programs in the United States. Surprisingly, more than half of the cases were classified as myelodysplastic syndromes and classifiable. If you look at papers published by academic centers, this category tend to be very small and sometimes actually not even mentioned, potentially was excluded by those centers. It also tells us that the diagnosis of MDS is very tough, and the subclassification of MDS is even tougher when more than half of the programs is classifying this disease as unclassifiable. We also looked, has there any prognosis change, improvement over the years? In this study, which is more than 10 years, we unfortunately have not seen that we have gained any improvement in the treatment of myelodysplastic syndromes. One of the findings in our study that we looked at is there anything to predict worse outcome in patients with myelodysplastic syndrome? And there was no surprise that the elderly patients did worse. Patients who were older than 65 had worse prognosis. This was not a surprise. Also, patients who had Medicare insurance unfortunately did worse. And we're not sure why is that. Is it because of the care they got, or is it because of their status, or maybe other factors that would predicted a worse prognosis? Additionally, males and Caucasians did worse, and we're actually not sure why was that the case in patients with myelodysplastic syndromes. Interestingly, patients who were treated at academic centers did better, and this was an interesting finding. For some reason, patients who were treated outside of academic did worse. You could argue the disease is tough and needs a lot of care. Maybe it's not as great in non-academic, or it could be something else that was the cause for that. It comes to us with a little bit of surprise, knowing that 3 drugs have been approved around 2004 to 2006. But at the same time, no drug has been approved since 2006. It calls for much more research and resources to be given to this disease, where more than 15 to 20,000 new cases of MDS are diagnosed in the United States. It also tells us that we need to do a lot better in terms of research and trials. Fortunately, there has been several approvals and breakthrough drugs in acute myeloid leukemia. However, we haven't seen such improvement in MDS. We hope that our data with our findings help all these trials where to focus and where to look at, and hopefully bring new drug and new hope to patients with MDS. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.